Yes, hi everyone. This is Dr. Khan, Executive Plastic Surgery, Bloomfield, Michigan. So I've just done what is an N block complete, 12-12-24, initials XYZ. This patient really wanted to stay anonymous. She is from planet Earth, and as you will see right here, this is what is a set of implants, saline, the smallest ones that they ever make, and a lot of inflammation. This is her third set. The first one was in the 90s, early 90s. That was a silicone one that the left one ruptured. Then she got saline, and then the third set saline. So as you can see, look at the way this was removed. You can see the calcifications. This is a lot of inflamed tissue. I removed some of the scars, the old scar that she had. A very prominent plastic surgeon removed her second set and put in a very small implant. You can see the big scar that I removed. Now I want to go ahead and go on from here. You can see, look at the extension of this. It does not look healthy. So as I go in, I just want to show that this is inflamed tissue. Nice lady from out of state. And so as I go in, look at this scar tissue right here. I have had to remove all of the scar tissue because when I feel it, touch it, it does not look good. It does not feel normal. So what I'm going to do is I am going to go ahead and go in from here. Actually, let me turn around because I don't want to hurt my scissors. It's calcified. The smallest implants, saline, back in 2003, the silicone implants were banned, so she could only get these saline. And after her rupture, she only wanted something safer, i.e., and as you can see, look at this. She's in her 60s. Nice lady, well read. As soon as I go in, you can see the implant. The other thing I want to show here is, see how thin this. I'm actually going to take the ruler to show, you know, no matter how thin the capsule is, it has to be removed completely, definitively, sincerely. So you can see how thin this is. That's the whole surgery. Anyone can remove implants, but it's all about removing. You know, you can see these calcifications. Look, this actually jumped up on my scissor, and you can imagine how she was living over the years with a lot of inflammation, especially on the left side. I have the operative note from her surgeon. Look at these calcifications. So this is your McGann 120cc, the smallest implant that I've ever removed. Look at this. And look at the fluid around. None of this spilled into the chest. And McGann 120cc implant. So you can see fluid that's dropping here, and if I go like this, you can see there's like a white tinge to it. Look at the inside. Actually, you know what? Where can I get a syringe?
Syringe.
Okay. This is why you want to do an end block. So someone asked, why do you do an end block? Look at this fluid. Right? I'm going to send this to cytology because this is enough to send. And see how thin that capsule was? So this is your yellow turbid. Two cc's. Hopefully they're going to be able to. Let me get some more here. And you can only imagine how much inflammation there was around this. So you can see, like, literally it's like an eggshell, if you will. And I'm going to actually invert this so you can see. Look at the scales of a fish. Calcifications. Saline implants. Are they safe? You decide. I'm not going to say. They are not lifetime devices. And if you ask me, it's not healthy, normal to have this. And you can see how hard this is. And I'm actually going to pull these off. And look, I will tell you, these are just very hard calcifications and very thin and only on this side you can hear the snap. I'm trying to feel for masses, anything like that. I don't feel it. And again, look at this teeny tiny implant. This is like the smallest implant you're gonna ever see, 120 cc's. If you ask me, she truly did not even need this implant because she's got a lot of breast tissue remaining behind. Now, she might have put on some weight, but this is such a small implant. New gloves. So I cut out the scar, as you will see right here. Goes all the way. Full thickness. This helps with the contouring. Now, this was a very angry, irritated tissue. She had a history of silicone rupture on the left side. The previous surgeon, world-renowned plastic surgeon, one of the best surgeons that I know, that surgeon removed the silicone granulomas from the left chest. And these are irregularities, abnormalities that I had to incorporate with this capsule so that all of this hard tissue is going to be removed. And as I go in, you can see how hard is it. Look, it's like a mass. And remember, the pathologist is going to weigh in. Look at this tissue. It's like a mass, right? You can see. So that's why I remove it. Remember, volume is precious, but no mass to be left behind. And certainly consistent with this tissue as well. This is not healthy or normal. As I cut, you can see it's such hard scar tissue. If I feel it, it's like clumps of what I would say, grossly speaking, fat necrosis. Again, she has had a ruptured left breast implant, silicone, her first one. Look at the scar tissue right here. You can see. Do you want to leave this behind? Absolutely not. Look at the scar tissue. And I cut this open. It's very hard for me to cut. Look at all this hard scar tissue. This is gonna all go with the, technically this is a separate product, if you will. It is not associated with the capsule, but I incorporate whatever I find along with the capsule because I wanna, this is good healthy fat, but you can see where it was, it had to come out. So I'm gonna go ahead and go in. A lot of inflammation on this one. So I'm gonna go ahead and remove this. Saline implants is supposed to be the better, nicer, safer. So I'm gonna go ahead and pull them out. And remember, you're always thinking fluid. Any fluid around the implant, look how small, like teeny tiny, like a preemie implant. 120 cc's McGann, again. Very small. You can see the contracture on this. You see how it's folded up on itself over the years, 19 years later. So no fluid on this one. All right, so no fluid. And I invert this. Look how, you can see my glove. I don't want to use that ruler, so I don't want to cross-contaminate. So you can see, look how thin this area is. And the whole here is precision, such that none of this spills into the chest, no calcifications, no masses on the inside, but certainly on the outside, right here. So what I'm gonna do here is, I'm gonna send this all as one piece. So there you have it. Look, the calcifications on the right side, the fluid on the right side, and look at the left side, relatively very different with the masses around. I'm actually going to send this separate as a left chest mass because it's truly not part of the capsule. And again, the history of silicone granuloma, this lady was very meticulous. She had her operative notes from her previous two surgeries from 1998 and 2003. And so I want to go ahead and send that mass off separately. So the implants will be returned to the patient, capsule sent to pathology, left chest mass to be sent to pathology separate, rule out BIALCL, that very rare BIALCL cancer which is associated with implants. The right peri-implant fluid within the capsule will be sent separately to cytology, again to rule out BIALCL CD30 analysis. So 3 take-home messages. Number 1, the end block is critical. Do you want to find out that this fluid spilled into the chest, God forbid if this was bad? No. And anytime you have fluid around the implant, it has to be sent to cytology to rule out that very rare BILCL, because if it's not, then you will not know what it is. CD30 analysis needs to be done. Number two, one has to always go slow. Even with the smallest implants, this took a reasonable length of time, and all inflamed tissue around has to be removed. Number three, the surgeon has to remove anything irregular, abnormal, any tissue that looks and feels different. The sixth sense of the plastic surgeon who says that this is not healthy tissue needs to be removed. Remember, the surgeon also always needs to be thinking breast cancer. 1 out of 8 or 9 women will get breast cancer. She had an MRI done, so a complete workup. She and I talked at great length multiple times, and now as we go through the surgery, we will have, number one, complete removal of implant capsule, all inflamed tissue, and number two, all of it will be tested so that we have the peace of mind that everything was done according to the book. And we have the peace of mind. We have the peace of mind that everything was removed, everything was tested. Please continue to follow. This is Dr. Khan, Executive Plastic Surgery. I just want to say 20 years from now, I cannot imagine anyone else doing the surgery any better, any different, because we did according, if you look at the chest pictures, hopefully we'll get those up. We will see that complete removal was done such that only good, healthy, viable tissue remains behind. This is Dr. Khan, Executive Plastic Surgery.